brings you here all the way from Reno?
Pain,
What kind of pain? Talk to me.
lower back, and that's spread out to my rib cage.
So you're here number one for low back pain.
Well, that's what I was.
Number one.
Number one.
Low back pain started when?
When I first felt the pop, the dramatic pain was back in 2009.
2009. We're 2020. So 11 years ago, what happened? You felt a pop in your back.
Yeah, I was trying to pick out my 1-year-old nephew. He was crawling, tried to pick him up. It popped, and I was there for about, say, good 10 minutes trying to.
How big was your 1-year-old nephew?
Very small.
Very small.
Yes.
Okay.
So
And this,
to-
just hold on. So this was 11 years ago.
That was when I really felt.
That's when you first felt it.
Yeah.
So you bent over to pick up your nephew,
Mhm.
and did you feel it as soon as you came up, or just
Like,
that weight?
When I picked him up a little bit off the floor, that's when.
Okay. And you had that, were you still for a period of time, like you couldn't move because of the pain, or
I
you were
couldn't
still
move. It was
functioning?
painful. I couldn't breathe all the way in. Like I struggled to take big breathing moments. Like I kind of stay still for about 10 minutes, and then
Okay.
the pain didn't go away completely. But I was able to walk a little bit better, and
Okay.
uh,
That was 11 years ago.
11 years ago.
Okay, so what did you do for it?
Went to physical therapist.
Okay.
Put some ice, did some stretching.
Did they tell you what your problem was?
No, they didn't.
Okay.
Because I was very active. I was still in sports and all this stuff. So I was kind of going through the pain.
So you weren't told what was causing your pain. Let's just do treatment for you.
Yeah.
Does that make sense?
No.
It's a common practice, though, right?
Yes, it is.
Yeah.
Because I only went through one. I went through multiple, and did
Multiple meaning what? 2, 3, 4?
about 4
4 different physios, physical therapy places?
chiropractors, even all the way to neurosurgeons.
Okay, so first you went to physiotherapy. They did some treatment for you. Didn't tell you what your issue was.
No.
You went for how many sessions?
I went for about 6
sessions over a month period?
about a month and a half.
A month and a half.
Yeah.
What was your next option after that?
Well, it started getting better because I was in shape, and I kind of overpowered the pain, and
Okay.
but it happened again in 2012.
2012. So 3 years later, you were picking up your same nephew?
No.
Okay.
This was at work.
Okay, you were at work?
Yeah, I was picking up, again, just a piece of trash, and these same pop, same everything.
Same everything.
Same everything.
And then what happened then? What was that series like?
Then I went to a doctor.
An MD, a neurosurgeon?
It was an MD, and then from there he referred me to.
So immediately the MD referred you to a neurosurgeon?
Well, I went through the same process: physical, chiro. When I didn't feel any better, so.
But did they, again, second incident, you went to the doctor,
Uh-huh.
you were prescribed physical therapy and chiropractic.
Mhm.
Okay. And the chiropractor that you went to took x-rays?
Yes.
The doctor took x-rays?
Yes.
What did they find?
Didn't find anything.
Nothing is wrong with you,
Yeah.
but let's do treatment.
Treatment, let's bring swelling. That's all they found, swelling. So let's bring it in. That's all I heard.
So what happened? You strained something, you sprained something, they said?
They couldn't find anything. That's
So what were they treating?
just, I don't know.
Okay, okay, all right, no problem. So that was 2012.
12, yeah.
You went through a series of treatment,
Uh-huh.
and then what happened? You gave up?
No, after they couldn't do anything about it, that's when I went to the neurosurgeon, did an MRI,
Okay,
and he claimed he found a little tear in my L5.
okay. Now this is 2012?
Yeah.
Okay. He found a slight tear in your disc.
And my disc was compressed by 30%.
Which number do you remember?
L5.
L5. Okay, we're gonna have an interesting experience today. You're gonna learn a lot today,
Oh,
okay?
good.
And, okay, so they said your L5 was compressed 30%.
Well, it kind of lost some of the fluid by having that tear. So
Okay,
he wanted to go in there and infuse it.
of course.
So I refused.
Surgeons do surgery.
Yes.
Chiros crack.
Yeah.
Dentists pull, clean.
He claims that because my L5, I should have sciatica. And I don't know what sciatica is. I've never had pain.
Okay. Everything has been local pain for you, right? Localized in that area.
Yeah.
You didn't have shooting pain down
Nothing. Still this moment I have it.
Numbness, tingling,
Nothing.
none of that stuff. Just
It's
local.
one position because when I go to sleep, I can only sleep one side now, or one position,
Left side, right side.
right side. And sometimes when I overlap my leg, I just feel like a nerve, and then it's out right here. I'm like your funny bone, right here in the bottom.
But
And
that's now, right? That's not back then.
No, it's just not.
Let's go back 2012. You went through a series of treatment there. They referred you to the neurosurgeon because treatment did not work.
Yes.
The neurosurgeon found a slight tear in your L5, said you need surgery.
Yes.
You opted out not for surgery. What did you do then?
I just kind of
Dealt with it?
deal with it myself. A lot of
Okay.
stretching, a lot of ice.
That was 8 years ago, sir.
Yeah.
Okay. What was the next incident?
It kept getting worse and worse, and there were certain days where I just couldn't take it, and I ended up going back to a different neurosurgeon.
What did that second neurosurgeon say?
Found the same thing. Claimed I had the tear there.
So you had another MRI done
MRI
when?
2018.
18. So
18.
now fast forward 6 years, you
years.
dealt with it. 2018, you go back to a neurosurgeon. He says you have a tear, you need fusion again.
Same thing.
And what was the percentage of swelling or deterioration? Did they tell you?
Same percentage. It never
30%?
changed. Yeah, it never changed after all these years. So that's why I refused the surgery again. I'm like,
I'm being a little funny.
Yeah, I know.
Right? 'Cause- okay. So you refused that surgery.
Yes.
And then 2018, more treatment?
at that point, no.
Okay.
That was just me on my own.
And then how did you started searching online for
Yes,
something?
that's why I was just kind of desperate, and
Okay.
I found
You
a
found
lot
a
of
series.
them, a series of chiros, and you
Here
popped up.
Here you are. Okay. All right.
But- Can I tell you one more thing?
Please, you can tell me lots of things. No issue.
Back in, jeez, I was about 14 years old back in Mexico, 13.
Mhm.
So we come from the country, so we were milking cows. There was this cow. It was the first time for it to be a mom, so we were milking it. It was
Okay.
kind of wild,
Okay.
so we had to put a
She already gave birth?
yes, barely. So
okay.
and we had to milk it because the calf wouldn't drink all the milk. So
Right.
it was me and my cousin. We put a tight rope on her neck just in case. I was taking care of the calf. It got wild on my cousin, and he said, "Watch out." When I looked up, the rope hit me around the chest. I went flying. It landed on this side, on the barrel where we put the milk.
That makes more sense because what I see is over a 30-year-old injury.
So I was telling,
And we're going to talk about that today.
it was painful. I was sore for about 10 days.
That was how many years ago?
I was 13. That's about 32 years.
Sounds about right.
33.
And it's very consistent with the disc we're seeing, and it's not your L5, by the way. Just saying. Okay. So what did you do then, back then? It was just deal with it,
Just
right?
deal with it.
There's nothing to do. And if you show weakness, what happens?
You don't have a choice.
You don't have no choice. What part of Mexico?
Jalisco.
Jalisco. Jalisco is famous for
Tequila.
tequila
Mariachi.
and mariachi band.
Yep.
Is that where they originated?
Yes. Guadalajara.
Guadalajara. Okay, cool.
I'm real close
Very
to
nice.
it.
Okay, now from 2018, it's now 2020.
Mhm.
You're doing your research, you're dealing with it, you're trying to figure out a solution.
Yes.
You found, you're here now, you brought us some full spine x-rays.
Mhm.
Now we need to figure out what's going on. You're having the same stuff as you did back then, or it's worse.
It's gotten worse where,
How has it affected your quality of life?
well, one, sleeping. It's I've been waking up about 2-3 o'clock in the morning
Every day?
for the last 3 weeks.
For the last 3 weeks, okay? What else?
If I get up right now, or I'm working and I go home and try to rest, I can't. It's
Why?
Just, as soon as I sit on a semi-hard surface, it starts burning me.
Oh, okay. So if you're sitting on a firm surface,
Yes.
then the glutes start to burn or the back starts to burn?
Part of the glute, but mostly is
So left side, so it's basically this whole area
Right
here,
there,
yes?
right.
Does it go up into here?
no,
Just here,
It stays there.
not this side?
no.
Okay, I got it.
And then I get up and I'm kind of visual person. I know my legs kind of go this way and my body goes that way for about a minute or two.
Okay. So you know there's
When I get up.
You know there's a slight disconnect.
Yes.
Okay. All right.
And I'm stepping funny on this foot too. I noticed it's changed the way I step.
And no new traumas in the last 2 years?
No.
No new
No.
slips or falls? You're
No.
working?
Working, yes.
Okay. All right. Family?
No.
Okay. Activities?
I gave it up about 7 months ago because it was just too painful afterwards.
Okay. So my activity is very simple. There's no big rehab program with me.
Mhm.
It's simple. We'll figure out kind of what's going on, what's causing all this. I'm pretty sure we're going to be starting somewhere in the foundation. Obviously, all this work is based on the foundation, right? Foundation principle. Just walking. That's all I need you to do. Walk.
Okay.
Walking, icing, and water. That's it. Just like you hear me tell everybody. Rehab and exercise and all that's later. Okay, we're designed to walk.
Yes.
Right? And the way we get our power and movement is through lateral flexion of the lumbar spine. If we have a joint that's stuck in that, we're not getting our proper locomotion.
Okay.
So we'll check everything out for you. Okay, no problem. Is there anything else I need to know? Okay.
No, then I can.
As we go through the process, if you have a question, you stop me.
Okay.
If something doesn't make sense, you stop me.
All right.
If you're not comfortable with anything, you
Stop.
stop me. Okay?
All right.
All right, let's watch you walk. Let's go ahead and watch these dimples. Let's watch him walk. Go ahead and walk away. And just, there you go. And this is your walk, yes?
Yes.
Okay. Just walk back and forth several times. Come over here, turn around. Let's see the back a little bit better, actually. There we go. Go ahead and walk away. So you can see those dimples don't really move the way they should. Keep walking several times. And I notice you don't really swing your right arm. Is that normal?
I never noticed.
Okay. Keep. We got a little bit, it's not even a wiggle, it's just everything seems stiff. Everything just seems very, very stiff when you walk. I'm not seeing movement in the dimples, but I'm not seeing a lot of wiggling either. It's just kind of like this.
Stuck together.
Just stuck, okay? Come over here and let's look at your film. And this is looking at you from behind. This is the AP film. We have 24 bones in our spine, 23 discs in between, and we have the pelvis and sacrum, which is the foundation of the building.
Okay.
In order to have a stable building, we need to have a level base and foundation. This is your side profile looking at you from the side. Same thing, we're designed here to have what? 60-degree reciprocating curves. Now, I want to go over this one first in terms of your posture, then we'll go back to this one, then we'll come back over here. And so first, let's look at the overall posture. And the way we're looking at posture, we don't do what's called a plumb line. Well, when you go, did any of them, you went to a lot of places, did anyone check your posture? Did anyone do a posture assessment?
No.
Okay. So a posture assessment is they do what's called a plumb line. They run a weighted string, or a weighted string is run down the side of the patient. The ear should match the shoulder, the hip, the knee, and the ankle.
Okay.
I do it based on the x-ray. And the way we do it with the x-ray, we're going to take the lowest lumbar body and we're going to run a line up. And it should go through C7 and C2. So let's bring it over here for you.
All right.
This is your lowest lumbar is here, center. Lowest lumbar body is here, center. And what's the first thing you see?
They're matched.
C2 should be here, right?
Yeah.
So that's C2, and that's 3, 4, 5, 6, 7. I'm just showing you it's off.
Yes, it is.
So the upper body is behind your foundation. What does that mean? This is all working off balance because it's just trying to hold you up. That's part one. Does that make sense?
Yes.
Now, when we're looking at this x-ray, we want to look at the foundation. We said there's 24 bones, 23 discs, yeah? Let's go closer and look. We'll go through the numbers in a minute, but let's just look first at the foundation and let's see, what do we have here? Does it look symmetrical first? Does it look symmetrical? This looks a little different, a little bit lower on this side, a little bit higher on this side.
Yeah.
Look at the obturators or the circles. They look a little different shape.
Yes.
This one is smaller, this one is bigger.
Yeah.
That's just giving us a projection, an x-ray distortion. So it just tells us that it's not in alignment or it's not symmetrical.
Right.
Let's go over here and look at the tailbone or the sacrum. I'm just going to change the contrast for a minute so I can see something. Okay. We can see in the hips here, yeah?
Yep.
This is good joint
Nice
here.
joint
This
here.
is a little less in here, yes?
Yes.
Right side.
Okay.
Right side. Okay. Now let's go in this. And this is what I want you to see. It's very subtle. We do have to talk about your digestion also a little bit. But here's what I want you to see. This is S1 here. Okay? Tubercles. S2. Or foramen, I should say. Okay? S3 starts to bend. S4. It's very subtle, but there's a little kink in this area of the sacrum, very tiny.
All right.
And here's what I want to show you. Let's go back to this x-ray. And we're going to talk about all that in a second. You see this here? So this is S1. There's a little bump here, but more importantly, we got this nub here and this nub here. These are old tailbone injuries. These are old tailbone injuries on the sacrum. That's number one.
Okay.
Number two, if we look at your L5, this is your L5.
Mm-hmm.
Your L5 is wedged, meaning it's open in the front, closed in the back. There is scar tissue in there. It could be causing, but what happened to L4 over all these years? If I look at L4, L4 is getting what's called a vacuum sign, that lucency in between. That's degenerating more than anything else. Yeah. But that's not the cause. That's been compensating all these years and wearing out over time. So if we look at the shape of this disc, that's at least 30 years old. That's why I was asking you before, and you kind of confirmed when you were younger something happened. Now, we need to figure out first sacrum, okay?
All right.
Something down low here. If we need to get to 5, we get to 5. But as I said, more importantly is what's happening down in the sacrum, and we need to check your pelvis and foundation. Okay?
All right.
Now, let's go to the numbers. Let's see what the numbers tell us. Okay. All right. We have 256, 263, 75, 74. Good news is we don't have a leg length inequality, so that's good news. All right, so our base is good. Now, you've heard me talk about this, right? In terms of the misalignments of the pelvis sits on an angle. When it misaligns posterior, inferior, or back, the vertical distance will be larger. When it misaligns forward, the vertical distance will be smaller. Yes? And then we have 3.72 or internal rotation. So let's put that together with your sacrum. We have, now I'm doing an x-ray finding. I'm gonna find it actually on you, which one is stuck.
Okay.
Okay. So your left pelvis goes down, right pelvis goes up. Left pelvis goes slightly out, right pelvis goes in. So your pelvis favors to the right side, okay? But you have a rotated sacrum on the left side. This is the catch. This is the catch. So let's use the left pelvis as an example. It goes down and out. Okay? It goes down and out, and then the sacrum, so down and out, and the sacrum goes back. That's the disconnect on the left SI joint.
Okay.
Now, what the book tells us is this. If we're finding it's your left SI joint, and we have a rotated sacrum on the side of a PIEX. The book tells us to do the pelvis first, not the sacrum. Okay? If I find it's your right pelvis, then we do the right pelvis. Okay? If I find it's not the rotation, it's down in S3, I'm okay with working down low. Okay? Without working on rotation at the moment. That's the main thing I'm seeing with you, sir. Okay? That's number one. Now, let's go back to the full spine and see what happened as a consequence, because there is a finding here I need to discuss with you. So, if this is our level base, we can see the first one to come off level is L5. 4 immediately comes back to level. 3 goes off to the left side and takes those with it. Yeah, to the left. Here's what doesn't make sense we need to figure out, okay? Uncross your arms, please. Thank you, it's okay. You have this x-ray finding. It's, if we were to define it, this is called flowing exostosis, okay? You see the cursor?
Yeah.
So it starts here about T11, and this is all calcification. The body is just trying to fuse all of this together. The question is why? There is something, possibly, we need to rule out ankylosing spondylitis, okay, as an ankylosing spondylitis is an inflammatory arthropathy or an inflammatory condition.
Okay.
We just need to rule that out. And I'll give you the blood test that you need to go take.
Okay.
Okay, we'll rule that out. Why I'm saying that and why I'm pointing also this stuff out, you can see the bones are concave. They're compressed.
Yes.
That's all the fun you had back in the day, okay? That's all the mariachis and tequila, senor. I'm joking about that. But those it tells me you were a very active guy.
Yes.
I know that, okay? But we need to know why is this. And the other thing I'm pointing this out is this is all stiff in here. I know that.
Yes.
So I don't know that we're going to get big, loud crack sounds, which we don't, that's not the goal anyway. But here's the other thing I'm pointing it out for. If we find the issue in your low back and we start focusing on the low back, then theoretically this stuff starts to balance out. If it's balancing out, you're going to tell me the day it all starts to crackle in the middle of your back. It's not a bad thing
All right.
in your case. Does that make sense,
Yes.
sir? Okay, let's continue. So we got that all the way up to about T1, 2, 3, to about T4. T5 is getting it a tiny bit there. So from T4, we're good. This is T4. But you can still see, right? There's a kink.
Yes.
Okay, and all of this is coming from where? A function of the foundation. So that's what we need to figure out right now. Okay?
All right.
Did you know about any of this?
No.
Did anyone point it out?
No, first time.
This flowing exostosis has been there for a while, so I'm very surprised no one pointed that out to you. Now, we do have a lot of undigested food going on here on this right side. This is the ascending colon, transverse descending colon. Okay. You're not here for a digestion case. You tell me you don't have any digestion issues. What you will discuss in a couple of visits is you'll tell me if anything has changed in your digestion. Fair enough?
Yes.
Okay, can we get started?
Yes.
Starting at the base of the neck. And the first thing we're getting is 20 points, 15 points. But what I want to notice is there's no break here. This is heat. And this heat is what? It's compensation. His muscles are working off balance.
Mm-hmm.
And where is it coming from? Right there. We're doing this a few times, and he's had things going on for several years, so the body is out of balance, and there's a lot of compensation going on here. It's actually a little bit higher. It's 10 points around T4, T5 area. Let's continue down. Now, we know there's a lot of flowing exostosis in through the mid-back. Does that mean we can't clear nerve pressure if there's pressure there? We still can do it. Here, though, there's nothing in his middle back. This is all compensation. And it's not to say, as we start to work on your foundation, things will shift around.
Okay.
And as they shift around, we'll deal with it as it comes up, okay?
Okay.
And we're getting down low in the tailbone, and it's down low, S3, S4 even. That's where it's starting, sir. You were told L5 disc, huh?
That's.
And you were lying down for the MRI?
Yes.
Yeah. You can go back to some of my videos and I talk about non-weight bearing MRIs, okay?
Okay.
Yep, S4. S4 around T4. These are your two majors here and here.
Okay.
Okay, next thing we want to do is check movement in the pelvis. Scoot forward, sir. Feet together. Open and close your knees. There you go. Left side only. Good. Right side only. So when you do the right, the left side is fine. Left side only. And when you do the right, when you do the right, the left is fine. When you do the left side, do the left, please. There is some movement at the end range on the right pelvis, okay?
Okay.
All right, scoot back for me now. Let's check motion. Top of the joint, back towards me. Good, I'm gonna turn you this way. Middle of the joint, bottom of the joint. Middle of the joint, bottom of the joint. More tender when I push at the top or more tender when I push at the bottom here?
The top.
Okay. Other side, let's check. Turn towards me. Good. Duele? Pressure from my finger or same as the right side?
No, I actually feel a pull up here.
You feel it pulling?
Yeah.
But not
No
pain?
No pain.
Okay. Well, that's good. You feel the pull. What does that tell us? It's compensating,
Compensating.
right? Okay. Now let's figure out here. Back towards me. Go into extension a little more. There you go. Back towards me. Número 5. Número 4. Duele?
Cuatro.
But we saw 4 as what? The disc is less, right?
Yes.
Número 5 duele?
No.
So I don't think it's your L5, sir. S1, S2, S3. Right there.
Yeah.
Aquí.
Sí, ahí.
Sí. S4. S4. Head down, sir. Let's check up top. Seven. 1, 2, 3. ¿Duele? 4 or 5. 4 or 5. 4
Cuatro.
or 3.
Cuatro.
4. Let's listen carefully, guys. So this area, this is the lung field. When you're tapping on the spinous processes, there should be this is called percussion. As I'm doing this, it's a hollow sound. Okay, you can hear it. As soon as we get here, it's a thud.
Yeah, it changes.
You feel the difference
Yeah.
too, right?
Yeah.
So the swelling changes the sound on percussion. When we're percussing the spinous processes here, C7, T1, T2.
Yeah.
¿Sí?
Sí.
4. Número 4 y 4. S4, T4. That's where we're going to start today. This is an interesting combo. Very different. You ready, senor?
Sí.
Let's do this. You sure you're ready?
Sí.
Showtime. Let's do it. You got people waiting for you to see how you do?
A lot of people.
You got a lot of people. Why do I know that? I shouldn't know that.
Because the sport that I play,
What sport?
volleyball.
1, 2, 3, 4. Deep breathing, sir. And out. You gotta give it to me though. Turn your hands the other way. There you go. Exhale. I'm just prepping. Deep breathing and out. Deep breathing and out. You gotta relax the shoulders. Home run, sir. Gotcha. Come off the table slowly, please. Not too bad, yeah?
No.
Different.
Yeah, a little bit different.
Let's walk. Walk several times back and forth. Well, you actually got movement in your dimples now. And walk several times, please. As you're walking, anything different for you?
Feel lighter, for sure.
Keep walking. All right, let's start T4. We're gonna do T4 actually in the chair. Sit over here, please. We're gonna start it here. And here's the thing. It's actually one of the things I love about this Gonstead work. It's one of the only methods that does the thoracic, upper thoracic in the chair.
In the chair.
So what I want you to see is here, this is 7, 1, 2, 3, 4. I'm down here, T4, okay? T4, there we go. Good. And what I want you to see is what happens up top on this chest. Because the idea with T4, it's gonna be light. Let's see what we can do. There we go. Relax the chin down. Good. Palms face up. Good. Now I gotta really stabilize, okay? And I gotta let that head fall. Left side. Left. Good. You're fighting though. There it is. Good. That's a little piece. Come over here. Face down. Hands down. Hands down to the floor. Back of the palms touching. Good. That's a little bit. There you go. Gotcha. That was the home run. Come off slowly, please, and let's walk. As you're walking, I want you to swing your arms, if you don't mind. There you go. Good. Just keep walking, sir. Mm-hmm. What's different?
Take bigger breath, for sure.
Interesting. Interesting. Good. Have a seat over here, please. Deep breath in and out. That's rescope. That's a little different for you?
Yes.
Okay. But I'm not working on your breathing, am I?
No.
I just adjusted T4 and S4. Let's see what happens now. Neck is clear. There's no heat in the neck either that was happening. It's coming from T4. T4 is clear. Fantastic!
Good.
Let's see. All clear, dude. S4 is clear. Let's repalpate and see what's different. Back towards me. Número 5. See? S1. S2. Back towards me. S3. I can feel that move now. Good. Let's go down to S4. Bueno.
Bueno.
5. Bueno. 4. Diferente.
Diferente.
Ah, hermano. L4 was sharp before, correct?
Yes.
And now?
No.
Is it just finger pressure
Finger pressure.
or little sharpness?
Finger pressure.
Very nice. You're a volleyball guy.
Yes, I am.
Gotta tune it all up. Tune up the shoulders, tune the ears, balance. Shoulders, let me do the work. Over, around. There you go. Over, around, down. That's it. On your back, please. What's your height?
6'3".
6'3". Or as one of my patients would say, 5'15".
There you go.
5'15". He was actually 5'19". Foot, right talus. There you go. Stand up, please. And now let's walk back and forth a few times, please. As you're walking, a little smoother.
Yes.
Can you sit on the floor here for just a second?
Sit on the floor?
Wall? Yeah. And the test for you is not sitting. The test is it should be easier to get up now.
Yes.
Squeeze my hand. Squeeze. Your hands are good, dude. Homework, water, walking, ice. Ice the areas I adjusted 2-3 times, up to 4 times a day.
Okay.
20 minutes on, wait at least an hour before you do it again.
Okay.
Okay? Water, you know the deal. For you, I'd say at least a gallon a day.
Okay.
Walking, hour walking or up to 15,000 steps a day.
Okay.
As you see fit. I don't want you doing any workouts or anything right now. You're coming from far though, so we need to figure that out. The main thing right now is get your walking in, get your icing in, and we'll need some sort of follow-up in a few days.
Okay.
Okay?
Sure.
Welcome to the
Sure.
office. You got it.